Hello everyone, we are from Group 5 and would like to present about visual standard requirements for transportation with suggestions of improvement and sports for visual impaired athletes. I'm Cassie and will present about comparison of visual function standard of land transportation in Malaysia with other countries. Visual function tested for licensing includes visual field, color vision, night blindness, visual acuity, and also diplopia. However, not all countries include all these requirements for obtaining a license. Let's start with visual standard requirements for land transportation in Malaysia. In Malaysia, private driver needs to have minimum VA of 660 in each eye without glasses and VA of 612 in the better eye with glasses. For commercial driver, they need to have VA of 612 in each eye with or without correction. Visual field is not tested for private driver in Malaysia, but commercial driver needs to have binocular visual field of at least 120 degrees along the horizontal meridian. For color vision, private driver needs to pass the Ishihara test, whereas those with severe red defect is not qualified for getting a commercial driving license. All drivers are not qualified for licensing if diplopia is present within the central 40 degree, even if the diplopia is correctable with a prism. They are also not qualified for licensing with night blindness. Next country is Australia. Private driver in Australia needs to have BCVA of 612. Commercial driver cannot hold an unconditional license if the uncorrected VA is worse than 6.9 in the better eye, or if the uncorrected VA is worse than 6.18 in either eye. Next, all drivers need to have binocular visual field horizontal extent at least 110 degrees with 10 degrees above and below the horizontal midline. Unconditional license cannot be held by both drivers if diplopia is present within 20 degrees from central fixation. There is no color vision standard for all drivers in Australia. Next country, United Kingdom. Private driver requires same VA requirement as in Australia. For commercial driver, better eyes should have VA of 67.5 while worse eyes should have at least 660. Private drivers need to have a field of at least 120 degrees on the horizontal with extension of 50 degrees left and right. For commercial driver, horizontal visual field should be at least 160 degrees with extension 70 degrees left and right and 30 degrees up and down. There should be no significant defect in the binocular field for them. All drivers must not drive and must notify DVLA if they have diplopia or color blindness. Next country is United States. Private drivers in United States have same VA requirement as in Australia and United Kingdom, whereas the commercial drivers have same VA requirement as in Malaysia. For visual field requirement, private drivers need to have minimum 140 degrees, whereas the commercial driver need at least 70 degrees in horizontal meridian. Next country, New Zealand. Private drivers in New Zealand needs to have a minimum VA of 612 with or without glasses, whereas the commercial drivers need a minimum VA of 69. All drivers need to have a binocular horizontal field of 140 degrees and no significant defects will be present within 20 degrees of fixation point. Private drivers with diplopia should not drive until the condition has been treated and can only driving within daylight hours if night blindness is present. However, commercial drivers with diplopia are unfit to drive unless the application of granting a license is supported by optometrist or ophthalmologist report. They cannot drive with night blindness. Drivers with cataracts or aphakia cannot drive if facing difficulties with glare. However, there is no driving restriction for color blindness. Overall, there is no common standard throughout the world for the test performed. Vision-specific requirements for driving vary from country to country. Most common visual requirements for driver's licensing are visual acuity and visual field.
Next, the suggestions for improvement of visual standards in Malaysia for land transportation. It is suggested that functional acuity contrast tests to be used to determine the visual performance of the drivers, especially in older adults. These tests will evaluate vision over a range of size and contrast, which closely stimulates normal environment. Other than that, glare sensitivity tests also important to evaluate the ability to recover from glare. This is because increase in sensitivity to glare are closely related to night accident. In addition, useful field of view test is important to assess the cognitive aspects of vision of the drivers. The elements in this test consist of processing speed, divided attention and selective attention, which are able to capture both visual sensory memory and higher order attention abilities of the drivers. Lastly, driving simulator can be added as one of the tests to evaluate the driving performance for drivers with diplopia. This simulator uses various cues and traits including near-accident situations, stimulus recognition and reaction time.
Next, let us compare the standard visual function requirement for sea transportation between Malaysia and other countries. Seafarers are required to be tested in these several visual functions to be qualified. Seafarers in Malaysia can be divided into two categories, which are deck officer, engineering officer and radio operators. Malaysia follow the SCTW minimum in-service eyesight standards for seafarers. In Malaysia, the deck officer need to have uncorrected VA at least 660 and corrected VA at least 612 in both eyes at distance, and at near, having CIE color vision standard 1 or 2, normal visual field and has night vision to perform necessary functions. Diploma is not accepted. For engineers and radio operators, they need to have uncorrected distant VA at least 660 and corrected VA at least 615 in both eyes, and at near, having CIE color vision standard 1, 2 or 3, having sufficient visual field. The requirement for night vision and absence of diplopia are same as deck officer. New Zealand also follow the SCTW minimum eyesight standard as our country. In United Kingdom, it seems like more strict to become a deck officer, as the corrected VA at distance should be at least 6.6 in the better eye and 6.12 in the worst eye. Need to pass color vision with the test below. The visual field is needed to more than 120 degrees horizontally and no defects within 20 degrees of the fixation. Diplopia, night blindness, retinitis pigmentosa or any progressive eye disease is unacceptable. In Ireland, the visual acuity and visual field are same as UK, but the color vision for deck apartment and engineers require confirmation of Leighton and City University tests respectively. In Canada, CIE color vision standard is 1 for deck officer, 2 for engineers. Deck officer need to have visual field of 150 degrees horizontally and 135 degrees vertically. In Poland, the visual acuity and visual field are same as Malaysia, no diplopia, having normal color vision. If any misreading cases, we can use the alternative test below. In South Africa, the VA for deck officer is same as UK. For engineers, the corrected distant VA is at least 618 in both eyes with normal color vision. For the visual field requirement, it is same as UK, and night blindness, retinitis pigmentosa, and diplopia is not accepted. Monocularity is accepted in some countries if the corrected better eye fulfill the minimum VA requirement, such as UK and Ireland, the VA at least 6.6, and Canada at least 6.12 for deck officers. UK and Ireland require VA at least 6.9, Canada at least 6.15 for engineer officers and radio operators. South America with no evidence of progressive eye disease in the remaining eye. In conclusion, there is no contradictory difference found in visual function standard requirement between Malaysia and other countries. We do found that monocularity is allowed in some countries such as UK, Ireland, Canada, and South America.
Next, the suggestion for improvement of visual standard in Malaysia for sea transportation is the recording of stereo video footage, which it can record various objects that can mimic the actual condition in the sea. The visibility of the object can be determined by various external factors. In addition, it is also suggested that the projection of stereo video, which use horizontal and vertical polarized film, to be used to assess the visual function of the sailors. This technique involves the assessment for night vision, color vision, depth perception, and also the weather in various conditions. These two tests are also applicable for drivers in air transportation. Other than that, the test for color vision should cover all the type of color defect and precisely determine each type of defect based on quantitative and qualitative response. These are the suggested diagnostic color vision tests that can be used, which includes dichotomic, qualitative, and quantitative assessment.
I'm Lavinia here, and I would like to present about comparison of standard visual function requirements in air transportation between Malaysia and other countries. In Malaysia, there are 3 classes. In Malaysia, there are 5 specific requirements. For distant vision, it must be with or without correction, and it must be 6.9 or better monocularly, and 6.6 or better binocularly for class 1 and class 3. And for class 2, it must be 6.12 or better monocularly, and visual acuity binocularly should be 6.9 or better. For near vision, the applicant should be able to read N5 at a distance of 30 to 50 cm and N14 at 100 cm for class 1, 2 and 3. Color vision, applicants shall pass the Ishihara test, and if failed, can be assessed with a lantern test. Last 2 will be binocular function and visual field, which requires normal binocular function and normal fields of vision. In Canada, the distant vision requirement is 6.6 in better eye and 6.9 in the other eye uncorrected. For near vision, they require N5 at reading distance and N14 at 100 cm. For binocular function, they require heterophoria, no more than 10 exophoria, 10 isophoria, and 2 hyperphoria. In Canada, there is an extra requirement, which is the intraocular pressure less than 22 mm mercury for color vision If the pseudo-isochromatic color plates and blue-yellow plate for Triton defect gives lesser than 1721, we can continue with other tests like Holmes' right lantern. United States, the distant vision for each eye should be 20/20 aided. For near vision, it should be N4 or better in each eye monocularly without correction, and for binocular function, the Fourier must be within 6 diopter of horizontal and 1.5 diopter of vertical prism. The color vision using the PIP test must be 12-14 pass, and they also accept color safe individuals. For the stereopsis test, in the red dot and thickness, it must be 42nd of arc, and the intraocular pressure must be 8 to 21 with less than 3 mm mercury difference. Next, we are moving into New Zealand, which has its own 3 classes. For Class 1 and Class 3, they require distant vision with or without correction at 6/9 or better, and near visual acuity must be N5 or better with or without correction, and there must be no deficit of color vision in the individual. For Class 2, the distant visual acuity must be with or without correction at 6/12 or better, and near visual acuity must be with or without correction at N5 or better. In conclusion, there is no significant difference in standard visual function requirements in air transportation between Malaysia and other countries. Countries such as United States and Canada has additional requirements like stereo acuity, intraocular pressure, and contrast sensitivity.
Lastly, the suggestion for improvement of visual standard in Malaysia for air transportation is the color assessment and diagnostic test, which completely isolate the use of color signals of the eyes. Hence, it can accurately detect the type of color vision and its severity. Other than that, the test on low illumination acuity should be standardized. In addition, dynamic visual acuity also should be done to consider the visual disturbance faced by the pilots. Besides that, some visual skills also important for air transportation. For example, eye-hand coordination skills are required to make sure that the pilot have the ability to use their hands and eyes simultaneously. Secondly, the facility of accommodation should be flexible as they need to change fixation in and out from the cockpit. Thirdly, central peripheral awareness is important for survival during air-to-air combat. And lastly, visual time reaction skills that are needed to scan, analyze and react to the presented information.
Lastly, I am Fatin Akilah with metric ID A174192, and I will presenting about type of sport played by athlete with visual impairment and eye protection equipment in sport. A lot of sport can be played even though the person have visual impairment, but of course, certain sports need some modification in order vision impairment athlete can overcome their disabilities to perform in the sport. Firstly, goalball. Goalball is a Paralympic sport exclusively for athletes who are visually impaired and blind. With the auditory cues made by bells inside the balls, the athletes can know in which direction of the oncoming balls. The result from this study shown that athletes in category B2 and B3 are more effective during the offensive phase of the game, while B1 athletes are more effective on defense. Secondly, sport that can be played by visually impaired athletes is rifle shooting. In this game, the players are guided by auditory information when their vision are impaired. When a player aims closer to the target, the higher the pitch tone that heard from the audio in both ears. In this research, they found that no association between degree of visual function and shooting performance of athletes. All B1, B2 and B3 athletes can compete in the same class irrespective to their level function. Lastly, swimming also can be played by visually impaired athletes even without any cues. In this study, they want to find the relationship between degree of visual impairment and performance of athletes based on time. Among the 3 B classes, B1 athletes being the slowest one to finish the race compared to B2 and B3. Next, these are examples of sport and the eye protection that should be worn during the game to minimize the risk of having eye and ocular injury. For low iris sport, skiing players should wear goggles with ultraviolet filters because ultraviolet filters reflect UVA, UVB and UVC rays and protect the eyes even better against light reflected off bright snow. For medium iris sport, need sport goggles with polycarbonate lenses because polycarbonate lenses can provide good impact resistance on the eye. For high iris sport like air rifle and baseball need full face protection, while hockey need full face mask and sport goggles with polycarbonate lens to provide good protection to the eyes. In conclusion, a lot of sport is modified for people with visual impairment. Those modifications can help to overcome their disabilities and can perform well in the game. Furthermore, a lot of eye protection are available to enhance protection and minimize the risk of eye and ocular injury. So, this is the sketch of our group. That's all from us. Thank you for listening.